Hi everybody, it's Elle, creator of the Happy Birthday program. Today we're going to talk about how the program went, so let's go ahead and get started. The objectives of this presentation are to explain why I chose to address postpartum PTSD as my capstone, the outcomes of the program, and then recommendations moving forward. Some abbreviations that are being used throughout this presentation are listed here. PTSD is post-traumatic stress disorder. PP-PTSD is postpartum post-traumatic stress disorder. TBE is traumatic birth experience. VSCA is visuospatial cognitive activity. And WOM is word of mouth. So really briefly on my background, with my third birth, I had traumatic birth experience. I was measuring really big throughout my pregnancy, and I had actually had several scans looking for the twin, right? The hidden twin. And come to find out there was just too much amniotic fluid that wasn't caught until labor and delivery. And because of the amniotic fluid, the cord was short. And so when I gave birth to her, she went into distress, and the doctor had me push her out without a contraction, which was not fun. And when she came out, she was blue. And they worked on her for about a minute, trying to get her to breathe and cry out. And she finally did. And then they just moved on like nothing had happened. But for me, something had happened that wasn't addressed. About 13 months later, my sister had a traumatic birth experience. She had attempted a home birth that I attended, and she did get rushed to the hospital. And both she and her son had crash carts called, and they both almost passed away. So it was pretty traumatic, and seeing it back to back within 13 months of each other, I was really able to see how the experience I had impacted me and the experience my sister had impacted her. So for me, the way that presented was not being able to talk about it for years. My sister, this is goodness, 9 years ago, she still can't talk about it. So these are things that are really impacting moms. And the more I talked about this with more moms, the more I found out how common this problem was. I also completed a systematic review. Goodness, I'm in semester 9 and it was semester 4, so it's been several semesters now, about postpartum PTSD prevention. I completed a needs assessment, and I had 232 participant mothers, and I had 43 occupational therapy participants. So they both had separate instruments that they were answering, different questionnaires. And I also had an interview with my community partner mentor, who is an occupational therapist who works in the NICU, as well as a windshield survey. So windshield survey, some people are familiar with, some people aren't. It includes going to the site where you will be working, looking at demographic information, driving around, seeing accessibility, seeing the type of people that frequent the hospital, etc. And along with the occupational therapy, my mentor, the occupational therapist mentor, she gave me some very valuable information about how COVID was impacting the hospital system in general, but also moms more specifically. And it had changed. Policies and procedures had changed. So it was very important to have that interview. As far as the mothers and occupational therapists, they did have, again, separate tools, right, to assess them. All of the mothers had given birth within 5 years. And I was really looking for what kind of services did they not get that they wish they had. And the top one that came out was mental health services. Now, when I asked occupational therapists what role they thought we could fill, the top answers were musculoskeletal. So it was interesting to see that there was this divide, right, between what we thought, the need that we thought we would fill versus the need that it's desperately needed, the hole that's there. And in practice, I saw kind of a combination of both being needed, but definitely mental health was very important. In preparation for this project, I also completed a literature review. And in that literature review, I found that 68% of new mothers had symptoms of postpartum PTSD that were clinically high enough to be diagnosed should an appropriate medical professional actually diagnose them. And 4 to 6.3% of women develop PTSD, so they're diagnosed. 18.95% of high-risk mothers develop PTSD, and that high-risk group would be things like they've experienced a sexual trauma in their life, they've experienced domestic violence, etc. And there are several things that put mothers at risk. As I was building this program, I also looked at Centennial Hills Hospital's mission statement. So the big things that stood out to me are patient recommendations, physician preference, and purchaser selection, employees' pride, investors seeking, and long-term results. So these are all things that I tried to center my program around. And I think today what we're going to report on, those long-term results, will be excellent and fit right in. So what is the hospital's connection to the project? Well, Centennial Hills Hospital does have a women's health focus. They have several offerings that are not available elsewhere, such as laboring in a birthing tub, being mobile during labor, various things, just having a nurse midwife on staff to assist moms, which is so important. So several things that they offer that you can't find elsewhere in the Las Vegas Valley. So there's this holistic focus that fits in nicely with occupational therapy that is a holistic profession in healthcare. Also, Centennial Hills Hospital has a diverse group of mothers. I found that in my windshield survey. But I also know more generally, the Las Vegas Valley is an excellent place to do any kind of research or program development because we are one of the most diverse cities in the nation. So you're looking at many demographics when you're looking at the success of a program. And other cities may not have that, diversity. And so you don't know if the program would really work for people from many different walks of life and, backgrounds. So the project summary. Occupational interventions and consultation. That was one of my first focuses. I wanted to make sure that I was using occupational services. I also wanted to create digital resources that were innovative, so they weren't everywhere to be found on the internet, and they were easily accessible via my website, happybirthdayprogram.com. I also wanted to transdisciplinary train others, so people from other disciplines, such as nursing staff. I wasn't able to do as much as I wish I could have. However, I do have many resources on my website. I also, when working with nurses one-on-one, would talk to each one about my background, what I was doing, why I was doing it, how it worked, and really just giving them that training that they needed to understand what I was doing. So my project summary, why did I do what I did? Well, we know that in the United States, we have the worst maternal mortality rate in the developed world. That means that for moms who are giving birth in a developed country, the United States is the most dangerous country they could deliver in. We also know that the top cause of maternal mortality among white women is mental health, namely suicide. Black women, it is cardiovascular in nature, and that's their top cause of death during the maternal period. However, mental health is also one of the top causes. There's currently not enough information for Hispanic women, Asian women, Native American, Pacific Islanders. Project summary, why I did what I did. Well, first thing is in the United States, we have the worst maternal mortality rate in the developed world. This means that if you're going to have a baby in the developed world, the most risky place to do so is in the United States. We also know that the top cause of death in the maternal period for white women is mental health. So namely suicide, but there are many different, offshoots of that. And for African American women, it is also one of the top causes, although the top cause is cardiovascular related. So there's this whole in the literature. How do occupational therapists, or really anybody, how do we prevent mental health conditions following labor and delivery? And this is vital in that it can save lives. And so that's really what the aim of this project was to figure that out. There's a scientific literature for scientific sake, like neuroscientific research about approaches that can help, but there's nothing that's actually then applied in a clinical setting. Also, Nevada is the worst state for mental health. And this is something that Mental Health America tracks. And since they started tracking it, we've never gone above 47th out of 50 in states in terms of mental health. And we currently, as of 2021, have the worst mental health out of all of the states in the nation. So this is a particular problem in Nevada, and Centennial Hills Hospital is in Nevada. So that makes it a prime place to address the problem. Also within Las Vegas, we're one of the most diverse cities in the nation. And we have high interracial marriages, and we all live together in the same communities. We don't have that classic division that you maybe find in other cities that are older. Also, Centennial Hills Hospital has a birth focus that I've already discussed, and that is a huge part of partnering with Centennial Hills Hospital. Okay, the project summary. So what did my day look like when I was working at Centennial Hills Hospital? Well, I would start off every morning and do chart reviews for all moms. And the reason why I did that for all moms was because there was no way to look and see who the most recent woman who gave birth was, which is vital if you're trying to treat women within 6 hours of giving birth. So I would end up going through everyone's chart and reading through it and picking out who to see in which order. I would then do traumatic birth experience screenings for all moms that I saw. And for those moms that had a traumatic birth experience within 6 hours of giving birth, I would do visuospatial cognitive activities. Now, this was complicated by labor and delivery occasionally keeping moms up until about 5 hours after giving birth, to where I wouldn't be able to see them until it was already too late. It was often that it would be 15 minutes after the 6 hours expired that I'd be working with moms, which is very unfortunate. Then I would consult with moms. And so whether this mom had a visuospatial cognitive activity intervention or not, I provided a consultation as I felt that was my ethical duty. I also created content that I put on my website. I uploaded to YouTube, all of those things. I disseminated those items in that way. So items for healthcare practitioners, whether it be therapists or nurses, as well as items for mothers. Now onto the fun part, the evaluation. And I just want to note that this is a very base level. We still have data coming in. We have about a third of all moms who participated who have reported back, as we have to wait 4 weeks, anywhere from a month to 2 months after they gave birth in order to get that data. So how many moms had traumatic birth experiences? 53%. Now, the assessment that I used had been validated, right? I talked about that. Well, the researchers who validated it during their research found that 54.4% of moms had traumatic birth experiences based off of that intervention, based off of that tool, that assessment tool. And I found 53%. So that's right on par. That's right where we want it to be. How many moms received geospatial cognitive activities? And that is 22.1% of moms. How many developed PP-PTSD symptoms? 0%. I know it's cut off. You can't see it. Unfortunately, I can't move the camera. But 0% so far have developed PP-PTSD symptoms that would indicate possible postpartum PTSD. Now, it should be noted that 4 to 6.3% is over that first year, the span of that first year. So if I'm looking at the first 2 months, there's this possibility that it could develop at a later time, but it's less likely the longer it goes on. Project evaluation continued. All right, would you choose a mental health focused hospital over others without? 80% of my moms said yes. Should all moms have an OT consultation? 100% said yes. And then their satisfaction with OT consultation regarding mental health, 90% were satisfied. So this 90%, of course, I always want it to be 100%, and we can work towards that. But I'm very proud of 90%, especially when you consider this first wave of moms who've responded were the first wave of moms I worked with. So the program built with time and improved. So I anticipate that number will improve with time as well. But 90%, the positive word of mouth, that's huge. That's a big deal. So 100% of moms are saying yes, they need OT consultation, and 80% would actually choose a hospital with a mental health focus over one that didn't have it. From my market research, I found that something like 65% of the decision on a hospital to use is based off of positive word of mouth. We have 90% positive word of mouth. And then the second most common or influential factor into deciding which hospital to use is what resources they have, what kind of activities do they have, what focus do they have. Those types of things are going to bring people into hospitals. Now, it's important that we get moms into a specific hospital, your hospital, right? Because research has also shown that people tend to be hospital loyal. So if you get moms into hospitals for giving birth and they're just starting their family, they are most likely to continue to return to that hospital. So every time a child breaks an arm or a spouse gets sick or anything like that, they will go back to that same hospital. And as we increase, the amount of fighting for mothers as patients because birth rates are going down, all of those little things add up to be very important. Big picture sustainability. OT practitioners save hospitals money. There was a 2017 research study that was done by hospital administrators, not OTs, and they actually found that OT was the only spending category that when it was increased, that readmittance rates went down and cost savings went up. So this was including like 3 or 4 specific diagnoses, and obviously maternal mental health was not part of it. Maternal care in regard to OT was not part of it, but we used the same methods in this program, Happy Birthday, as general OT when we're addressing those other healthcare issues. So I would suspect that we have similar outcomes. OT practitioners are holistic and multi-purpose. We are the Swiss Army knife of therapy professions. So we can do musculoskeletal, we can do mental health, we can do feeding, we can do all sorts of things. And the reason why that's so valuable in mental health care, prevention or among maternity care is because you never know what you're going to run into. Moms have all different walks of life. They have different issues. And so having a healthcare professional who can address whatever comes up is so important. Now, as birth rates go down, competition goes up. This competition for moms, their services, the hospital, it's a real thing, and it's expected to become more and more tense. It's going to be more competitive. So every little thing that, a hospital can do to eke out the competition is going to be beneficial. Word of mouth and services dictate hospital selection. And that's what I was talking about. We know that from research. This isn't something that I came up with. This is something that, I've just gone through the literature and found. And so when you have 90% positive word of mouth and you provide a service that 80% of moms want, that really gives you an edge. So what is OT's role in the team? So first things first. Generally, people think of OTs as being rehab professionals, and certainly we can do that. But in the maternity care unit, that's not the role. The role is mental health, which is what OT was originally based off of, was mental health. And that's probably the biggest sticking point that I ran into with nursing staff. I actually on several occasions had nursing staff say, no, that mom needs to sleep because she had a traumatic birth. And I would think, no, that's the worst thing you could do right now, because those short-term traumatic memories turn into long-term traumatic memories when you sleep. That's when all of that work is done. And so you want to be able to reach those moms within 6 hours and interrupt the consolidation of short-term traumatic memories to long-term traumatic memories, which is a role that OTs, can do. And nursing staff isn't really aware of this. So they would think, okay, these are rehab professionals coming in to do weights with moms or some kind of rehab. And that is not what I was doing. And I, went to great pains to tell nursing staff over and over again, that's not what I'm doing. Just talking to moms, doing consultation, assessing mental health. And so that's what we did. I assessed using that global screener for traumatic birth. I also assessed for other things like lower back pain, wrist pain, etc. I consulted with moms on how to, prevent any kind of mental health issues that came up. For example, just talking about lower back pain, that is heavily associated with depression. And so if you have back pain, which is common during pregnancy, and then you're carrying baby and lifting inappropriately in a way that doesn't protect your back, that back pain can become chronic and depression can sprout up. So there are many aspects of this mental health prevention that OTs are going to be aware of because that's their jam. That's what they do. So consulting with moms and ways to prevent, I consulted on all sorts of things. So transition planning, safe infant handling, SIDS prevention, all of those things. And they're all mental health related, and it's all within the scope that I have and the education I have. So I would also educate moms, educate healthcare professionals, and these are roles that we can continue, right? That consultation and education, not just for individual patients, but also for other healthcare providers. And then there are also interventions such as the visuospatial cognitive activity, though there are other interventions that can be done, such as journaling. That's one thing that's been shown to be effective. Any kind of mindfulness or breathing activities. There are several things that have been shown to help prevent PTSD. The two most effective being the visuospatial cognitive activity and the golden hour when there's that skin-to-skin contact within the first hour to 2 hours after birth. So my practical recommendations moving forward during this interim period, right? Because you're not going to go from having no OTs in the maternity care unit to having fully staffed OTs. That's just not how it's going to work. But what I would recommend is that there be interprofessional training that OTs can head, whether that be webinars, whether that be, lunch and learns or CEU credits, classes, etc. Is really up to the hospital. That's something that OTs can definitely do. Also, I would suggest that RNs complete the universal TBE assessments. So that's a traumatic birth experience assessments. And the reason why I say that is labor and delivery can do that. 4 questions, very simple, as soon as baby's out and being cleaned. And this is vital because if we're waiting until mom goes to postpartum, sometimes it's already too late by the time they get to postpartum care. And OTs, it's very difficult to keep your handle on these moms who are like, trying to get a barrel of monkeys together, right? Because they're coming and they're going pretty rapidly. So having it at the source, labor delivery nurses do the universal TBE assessment. Really, it's 4 questions, super simple, super easy, would be the best. Now, following that, ideally, you would be able to get an OT to do the visuospatial cognitive activity intervention. So calling them over, saying, hey, this mom had this experience, have the OT do that. But if it's a case of you're not going to be able to get an OT there soon enough, then I would suggest having nursing staff who is trained on it do visuospatial cognitive activities with moms. And that's just something that's a fail-safe because the most important thing is moms are getting these interventions, even though an OT is going to be best able to decide what type of visuospatial cognitive activity is the most appropriate for that mom in that situation. As there are different ones. There are, for example, Candy Crush, Tetris, word search, picture find. There are several that you can do. And so an occupational therapist who is really, their expertise is occupation, which are things like that. So leisure, recreation, etc. That's within the OT scope of practice. That's what their expertise is in, that function, lifespan development, etc. So ideally it's an occupational therapist who does that. But, just to make sure those moms get those services, it would be very helpful to have nursing staff who could also do that. And then finally, when moms do screen for having had a traumatic birth experience, or there's some other troubling things that about mom's past, perhaps she was the victim of sexual violence that led to this pregnancy, perhaps she's having domestic violence at home, things that make her higher risk for mental health conditions, or even having musculoskeletal issues like really bad back pain, etc. That makes them more prone to develop these mental health issues. That's when you should call in an OT to consult with mom. Future recommendations to decrease maternal mortality and increase business edge. So education for all stakeholders, whether, again, that's webinars, videos, podcasts, and CEU classes for healthcare professionals. And I would say therapists, nursing staff, moms alike, any and everybody, because this is an emerging area that people are not aware of yet. And then OT practitioners in women's health. We need specialized training for OT practitioners in maternity care. And the reason why that is while we have all the tools that we need as occupational therapists to do the job, we also do need specialized training to understand the maternity floor, to understand what nursing's role is, what they're doing, what the abbreviations are. For example, PROM in the rehab world is passive range of motion, as opposed to premature rupture of membranes that we have on the maternity floor. So just trying to get that specialized training to prepare practitioners for the maternity floor. And then advertise cutting edge focus. However you do that, if you have commercials you use, if it's, online, just your webpage, front and center, advertise that. Advertise you have a mental health focus, because we know 80% of moms want that. And that's a reason that they will pick this hospital over another. Now, finally, if there are any questions that you might have, feel free to email me at happybirthdayprogram.com, or you can go to happybirthdayprogram.com and go to contact, and then you can contact me that way. It might take a week or two to respond, but I would be happy to answer any questions. And also, I want to give a special thanks to Cincinnati Hills Hospital, Kimmy, the nursing manager, Marie, my mentor, occupational therapist in the NICU, Jen, physical therapist in the NICU. She was also a mentor of mine. So I just want to thank them for their kindness, their warmth, and their support. There's no way I could have done this without them, and they were fantastic. Here are the references, and here are some more continued. Anybody who has gone through graduate school in regards to healthcare, but really any kind of graduate school, can totally understand evidence-based practice. I can do all things through evidence-based practice. And it's really true, though. I felt like the evidence really empowered me to create a program that works. So thank you so much for joining me. I hope that you got something out of this, and I'll see you next time. Bye.